Hey, thanks for making it to Veterans Info Tap. I'm glad you made it today. Today I wanted to talk to you about a piece of information that I got regarding the VA, primarily the healthcare system, and some relaxing of the requirements that they have that they've had in place for the last couple years now. I did a video on this a while ago, and it was kind of the first step in this progress, but finally the VA is now relaxing the masking requirements at the healthcare facilities. This news release came out May 30th, so a couple days ago, 3 days ago, or what have you. So wanted to just read through it to bring everybody up to date on what's going on for when you make your next trip to the VA healthcare facilities, whether it's a clinic or hospital, what have you. So with that, let's just go ahead and jump into it. So here it says, today the Department of Veterans Affairs announced that it has relaxed the masking requirements at VA medical facilities. VA facilities will no longer universally require masks in most clinical areas. So the key word here is most, right? So let's see what they have to say about it. Now that the public health emergency has ended, we are updating our masking policies to reflect our new reality while still ensuring the safety of veterans we serve, said the VA Undersecretary of Health, Dr. Shereef Elnahal. Except for the highest risk areas and situations, masking will be greatly relaxed for veterans and clinicians at healthcare facilities. So again, except for the highest risk areas and situations, masking will greatly be relaxed for veterans and clinicians at the VA healthcare facilities. So let's go ahead and go a little further here. Masks will continue to be required for staff, veterans, and visitors while in the high-risk areas listed below, including waiting areas. So let's see here. There's a list of 6. So 6 bullet points here. 1 is transplant units. 2, dialysis. 3, chemotherapy units. 4, emergency department and urgent care. 5, open bay medical intensive care units. And 6, spinal cord injury and community living centers, staff and visitors only, with the exception that visitors to the community living centers and SCI may unmask when visiting with a patient within the patient's room or outside. So little caveats there. Moving on, masking also continues to be required, and they got 3 bullet points here, for those with suspected or confirmed COVID-19 infection or other viral respiratory infection. So look, if you're sick, then they're going to make you do it, of anything, right? Especially in those areas where infections can happen easily. For VHA, Veterans Healthcare Administration, VHA healthcare personnel, upon request of a patient, a veteran patient, caregiver, or family member. Oh, interesting. So if, let's just throw out that you're highly susceptible to, multiple different issues, and you are more comfortable with the VHA healthcare personnel wearing a mask, you can request them to do so. Okay. And 3rd bullet point, where local leadership warrants continued masking is required. And it's always funny to me when at the higher level they go, this is what we're doing, and then they go, but where local leadership warrants it doesn't need to happen, then it doesn't need to happen. So I don't know, that always irritates me, but whatever. They're putting some control in their local leadership chain to deal with whatever they want to deal with. So the closing paragraph here is, during the pandemic, VA delivered more care to more veterans than ever before, providing more than 332 million healthcare appointments to veterans, caring for more than 870,000 veterans with COVID-19, and vaccinating more than 4.4 million veterans. Moving forward, VA will monitor any changes to CDC guidelines and update infection control recommendations as necessary. For more information regarding COVID-19 policies at VA, visit the Coronavirus Frequently Asked Questions webpage, and there's a hyperlink. So the bottom line is that we should be seeing far less requirements on masking at the federal level with regard to the VA and the VA Healthcare Administration, to be specific. So with that, just wanted to share that so things aren't a surprise as you're showing up and wondering what's going on. So with that, thanks so much. I really appreciate you, and remember, if we don't take care of each other, something went wrong.